Well, hey there, it's Chelsea with Wound Care University, and today I'm doing a solo episode. And today's topic is kind of a weird one, but we're talking about odor. We're talking about wound odor. Weird wound care fact of the day. Sometimes a wound can smell sweet, and you would not expect that because, like, normally when you think about wound odors, we're thinking pretty malodorous, but not always the case. You can sometimes come across a wound that smells sweet, fruity, or specifically even a little grape-like. That smell is very distinctive and is classically associated with Pseudomonas. That is a bacteria that can colonize or infect usually chronic wounds, stuff that's been open for kind of a while. Here in Texas, out by the lakes, we have soil that is colonized pretty heavily with Pseudomonas. So folks that get near the water, even showering, unfortunately, sometimes we'll end up with higher incidences of Pseudomonas. When you're looking at these wounds, you'll probably notice, along with this sweet kind of grape-like smell, there's going to be some bright green drainage. That's usually your telltale sign right there. Usually a lot more moisture. So heavier exudate that's normal. And you'll also notice the wound is pretty stalled out. Anytime an infection is present, you'll notice that the wound measurements either do not change or can even go up. Now, just because they normally go hand in hand, disclaimer here, a sweet smell does not automatically mean that for sure your patient has Pseudomonas. Maybe they did, in fact, put grape jelly on their wound. Who knows? And green drainage does not also automatically mean that it is infected. But generally, when those things go hand in hand, there is a little bit of suspicion there that that could be the culprit. Wound odor in itself can be influenced by quite a lot of things. The old drainage that might be on the dressing when you change it out, you should never really judge the odor until the dressing is off and the wound is cleaned off. Necrotic tissue can give you kind of a funky odor. The type of dressing that you're using, especially some of those grafts, sometimes will make them smell a little different. How long the dressing has been in place, cleansing products, and then, of course, like the amount of biofilm or bioburden that's on the wound. There's a lot of different factors here. So when we're sniffing things out, those smells could give us a clue, but it's not going to give us a clear diagnosis, right? Like our nose, we're not bloodhounds. We can't diagnose anything. So your first step is always going to be to remove your old dressing, cleanse your wound thoroughly, and then reassess it after you've gotten off all that surface debris and that drainage is out of there and has been removed. So after all of that, ask yourself, okay, am I still smelling this odor? Has that drainage increased? Is there any kind of new or worsening pain? Is the tissue more friable? Are we seeing hypergranulation tissue in the bed? Is my wound bigger? Is there more maceration to the peri wound? And then, of course, those really telltale signs of infection, we want to always look for redness, warmth, swelling, cellulitis, fever, and any kind of decline in the patient's overall condition. Those are all pretty clear signs that something's not going well. When we do that full assessment, that helps us to better figure out if we're dealing with simple colonization, or if we're dealing with a pretty serious infection. Now, there might even be a more interesting twist to this story. So we had a wound that smelled like grape. And now, when you have Pseudomonas that is suspected or confirmed, you can actually use a diluted acetic action solution as a short-term topical treatment. Acetic acid is the acid that smells a little bit like vinegar. It creates a more acidic wound environment that Pseudomonas does not like, and it does not tolerate it very well. That can help us to decrease bacterial burden, reduce odor, and support the disruption of that nasty biofilm when we use it, of course, in a complete wound care plan. So once your acetic acid is applied, your sweet grape-like smell might become much less noticeable, and now your room might smell like vinegar. So you have a whole kitchen going on in there. We have gone from grapes to salad dressing. Thank God y'all are in wound care, because otherwise this would be real gross. The acetic acid can be applied as a clinician-directed wound soak, irrigation. Sometimes it's used as like a moist dressing that's applied on there, depending on what protocol you are following. We, of course, don't want our patients to grab household vinegar, white vinegar from the kitchen, and pour this all over their wound. That's not a good idea. Household products are absolutely not prepared as sterile wound care solutions, so we don't want to do that or encourage that. Concentration is probably not appropriate, and we don't want to cause irritation or tissue damage. So not actual vinegar, just smells like vinegar. Even properly prepared acetic acid can sting or burn, especially when the wound has a large amount of exposed tissue, inflamed skin, or sensitive structures. So the clinician should always monitor the patient's comfort, the wound bed, and the peri-wound as well. Like with anything else, if that wound is getting painful, irritated, dry, discolored, otherwise getting worse, treatment plan needs to be reassessed. In addition, that acetic acid is not something that we're going to continue forever. That's usually like a short-term fix at a very specific problem. Once we get that bacterial burden, drainage, odor under control, we're going to switch on to something else that really helps to support the moisture balance. And remember, of course, suspected bacteria is only one piece of the puzzle here. If the wound has devitalized tissue, we're always going to go into debridement territory. If our drainage is super heavy, we also have to be thinking about dressings that manage moisture, thinking about peri-wound skin. If it's getting macerated, how we're going to best protect that. If it's a wound that's being affected by pressure, we of course have to manage that as well. And then, of course, if it's a venous stasis ulcer, which a lot of these are, appropriate compression would be essential as part of this big picture to heal it. You can absolutely not disinfect your way out of an untreated underlying cause, even with some interesting smelling solutions. Same thing, systemic antibiotics should, of course, not be prescribed simply because a wound smells sweet, looks green, or has like a surface culture that came back positive. We need to be thinking about that more so when we have signs of cellulitis, spreading infection, deep tissue involvement, any kind of rapidly worsening tissue damage, clinical deterioration. In those situations, of course, we're thinking about additional testing, cultures, antibiotics. So a sweet smelling wound might put you in the direction of Pseudomonas, but it's always just a clue to get our big picture. Clean your wound, reassess it, look at your entire clinical picture, always address your necrotic tissue, your drainage, your moisture, pressure, edema, perfusion, and your patient's overall condition. So just keep in mind your wound might not smell so sweet after that, which is kind of the goal here. And you never want to be able to say, sweet wound, bro.